Should group home residents get vaccine access as early as those in long-term care homes? Let's look at the COVID case numbers. As updated daily by Public Health Ontario, there are currently 226 active outbreaks in long-term care homes in the province, compared to 64 in group homes and supportive housing settings. And since the pandemic tracking began last March, there have been a total of 1,195 outbreaks in long-term care homes, compared to 459 outbreaks in group homes and supportive housing. So while there aren't as many active outbreaks in group homes as there are in long-term care homes, some numbers are still far higher than the general population. And advocates say those with intellectual and developmental disabilities living in group homes should be prioritized for vaccine. That includes our next guest, Jonathan Lai. He's an advocate for people on the autism spectrum, and he joins us from Toronto tonight. Hi, Jonathan. Thanks for being with us.
Hi, Ginella. I'm glad to be here.
So tell me, what makes group homes more susceptible to spread of COVID-19? I mean, there are maybe some obvious things that people might think of, but help us understand a little bit.
Yeah, so the risk factors for why people in group homes, a lot of them with developmental disabilities, they're the same risk factors that seniors in long-term care homes face. So there's a few I can list. You can think about that they can be just as frail as seniors. So many people with developmental disabilities, they age quicker and they show signs of frailty at a younger age compared to the general population. So that's one factor. Another risk factor is that, like seniors, many of them have more medical complex conditions, so co-occurring medical conditions, and that really increases the risk of what we call adverse outcomes due to a COVID infection. And with group homes, there's crowdedness issues. So data in Ontario has shown that having more than 2 residents per room leads to higher chances of outbreak. And as you mentioned, right now, 64 active outbreaks in Ontario. And across the country, our members are reporting out and that run group homes are dealing with outbreaks as we speak.
And are there any specific challenges unique to some of these groups in relation to social distancing and mask wearing?
Yeah, so all those are in place. And the difficulty is many of those public safety measures can be very distressing to some of these individuals. Many of them may have limited communication or understanding of the situation at hand. So one of our member organizations out in Calgary, actually, she was telling me they run a group home for children. And some of these children have been swabbed over 10 times, through their noses, and without really knowing what's happening to them. So there's obvious distress happening, a lot of outbursts and self-injury. A lot of them aren't able to access a known preferred caregiver, either a family member or somebody who typically works in their home, and that's very disruptive for some of these individuals.
And to that point, I mean, the pandemic really has kind of disrupted a lot of everyone's routines, but I imagine, especially with some people who have autism and other intellectual disabilities, that having that disruption to routine is especially difficult. So how would having access to a vaccine be able to kind of get them back to sort of their everyday, regular sort of life?
Yeah, that's a good question. So a lot of the measures that we started off are really about the safety and security of these residents, but it undermines some of their other real needs, which is, the need to socialize, the need to have family visit, like the rest of us. And for them, it's really stressful. So, we think these groups need to be prioritized in terms of vaccines. At the same time, the vaccine alone isn't going to be the antidote to a lot of the systemic gaps that we see in long-term care and in group homes. They're necessary, but they're not going to be a replacement for the real work that needs to be done. The pandemic's really shown us where the gaps are for Canada's most vulnerable.
And to that point, I understand that with staffing, that's also an issue in group homes.
Yeah, so it's improved, but definitely a lot of the transmission that's coming in is due to some of the staffing challenges there. You cited some Ontario numbers. So if you think about Ontario, there's some single site work orders where staff can't be traveling between homes. However, a lot of the staff, temporary staff, are carrying multiple jobs. Many of them, racialized minority groups. Many of them women working multiple jobs to have a living, and they're kind of forced to be in this situation. So there's a lot of changes that need to happen. Standards need to be set, guidelines need to be put in place for the quality of care to be improved for the residents and for the workers.
What do you hear from families and from the residents themselves as well about, in the absence of a vaccine and with all of the challenges of the pandemic, what are their options in terms of being able to take a loved one out or keeping them in? I'm sure there are some people who have had to weigh that out.
Yeah, for sure. So early on, we were kind of in that early panic mode. Everything was locked down and essential caregivers couldn't come in. The government policies generally have changed where essential caregivers could come in. And that's great. The policymakers have listened to some of the advocate voices in that area, but there's still a lot missing. What we would advocate for is to make sure the first voice, meaning the workers, the essential caregivers, and the residents themselves are being heard and informing policy. So the policies that are there are responsive to the needs of the individuals and what's happening on the ground.
Finally, why do you think this hasn't garnered as much attention, group homes, in relation to long-term care homes? And what would you like to see moving forward?
Yeah, so people with disabilities generally throughout this pandemic have been the forgotten voices. The most vulnerable among us, they're not being represented, they're not being heard at these tables where decisions are being made. So it's something that we push for. We want to show, we need to collect data. We need to understand better where the gaps are. And that's where we're seeing a lot of gaps in the housing file. At CASDA, the Canadian Autism Spectrum Disorder Alliance, we are advocating for a national autism strategy and guiding the government's development of that. And a big part of that is to look at sustainable housing solutions for autistic Canadians and those with other disabilities, so that they can, different housing solutions for different levels of function, that have different support needs for their day-to-day.
All right, Jonathan Lai, an advocate for those on the autism spectrum. Thanks so much for joining us, Jonathan, and sharing your insights.
Thanks, Ginella.